dizziness and pressure in my sinuses, and I just felt like I would either pass out or just if I walked, I had to lean against furniture at work or when we were in Colorado on vacation, and I just did not feel comfortable. I increased my water intake, and I did everything my OB doctors told me to do because I was nursing my son. I was still having a little bit of dizziness, and I was very concerned that I had a brain tumor. And we did a CAT scan of my sinuses to rule that out, and then an MRI in my head.
That dizziness persisted, right?
Right.
And so what did we do for your dizziness?
Well, the positioning with breastfeeding, I was always looking down at my son, or I would lean down to pick him up, and I would become dizzy. And I had stiff neck and neck pain, and I came to you, and you provided me with the McKenzie stretches that helped tremendously.
And then I see that in November of 2016, you came in with another complaint. What were you having at that time?
I was having abdominal pain at that time, the left lower quad.
And where was the abdominal pain?
Right here.
And what were you concerned about?
I thought it was constipation. I am a nurse and I see many diagnoses, and I thought it was cancer. I came to you and we did stretches, and it was relieved in the office.
So which exercise did we do for your abdominal pain?
We did the standing like this and stretch.
Thoracic, yeah. And we also did extension in line, the
Lying
lumbar
down.
stretch.
Yes.
And so the abdominal pain you came in, that got resolved during the office itself. So we didn't do anything after that.
Correct.
Then a few months later, you came in with some other complaints. What were those?
I had switched jobs, and I went from working on the floor to the clinic, and then I went back to the floor, and I was lifting a very, very heavy patient. I started having low back pain, flank pain, leg pain, and thigh pain. And I was nervous about pulling something, or if anything, if I lifted the wrong way incorrectly. I did my stretches and I was not getting relief, but I was not doing them in a timely fashion. During the day and working 12 hours, it put a toll on everything. And I was diagnosed that February with basal cell skin cancer, and I thought I had bone cancer.
Right.
Because my symptoms were pretty severe at that time, and my anxiety was through the roof.
So we ended up doing a MRI of your spine, MRI of your hip, and MRI of your left femur bone, right?
Yes.
Because you were, and everything was fine.
Yes.
And then eventually, what helped your pain?
My McKenzie stretches have helped tremendously with that, and I'm still doing those at home and at work occasionally.
And then you also came in one time with chest pain. Can you tell me where was the chest pain?
I was having mid-sternal chest pain that radiated to the left side, and this was while I was nursing my son. I actually went to the ER. I was working on the floor, had the severe chest pain, took my breath away. Staff members took me downstairs, and they diagnosed me with costochondritis.
Chondritis.
I continued my stretches at home, and the chest pain resolved on its own.
What do you make of what all you have gone through so far with so many complaints?
I think a lot of it has to do with the cervical and the thoracic, breastfeeding and the different positions, having a new baby, the toll on your body, looking down all the time, and
you were lactating till
I lactated for 15 months.
15 months, right.